Mistake 1. Doing the wrong exercise for the type of shoulder pain. One of the most common and at the same time most harmful mistakes when it comes to shoulder pain is assuming that all pain can be treated the same way. Many people start stretching, strengthening, or moving the shoulder without understanding what type of problem is present. This behavior, although well-intentioned, often makes the situation worse. The shoulder does not respond uniformly to any stimulus. Different structures may be involved, and each requires a specific approach. Ignoring this difference leads to a cycle of continuous irritation. The first point to understand is that the shoulder is a highly complex joint. It depends on the interaction between bones, muscles, tendons, and supporting structures to function properly. Small imbalances in this system can cause pain, limited movement, and loss of strength. When one of these structures is irritated, the body enters a protective mechanism. This mechanism reduces movement and increases local sensitivity to prevent further damage. However, when a person forces movement without identifying the cause, this protective system is activated more intensely. A classic example of this mistake occurs when there is internal shoulder compression, clinically known as impingement syndrome. In this case, there is a reduced space between the arm bone and the upper shoulder structure. When the arm is raised, the structures within this space are compressed. If a person tries to stretch or force this movement repeatedly, the compression increases, worsening the irritation. This type of pattern is identified through what professionals call a painful arc. Many people continue insisting on this movement, believing they are stretching, when in reality they are putting even more pressure on a sensitive area. Another common scenario involves weakness in a specific shoulder muscle called the supraspinatus. When this muscle is weakened or irritated, the shoulder loses efficiency at the start of movement. The person feels difficulty lifting the arm or notices unexpected weakness. In this case, the most common mistake is trying to compensate with more effort or using inappropriate exercises that require excessive load. This does not strengthen the muscle safely. On the contrary, it increases irritation and prolongs the recovery process. There is also a third pattern related to the muscles responsible for external shoulder rotation. These muscles are often neglected in daily life. Most activities involve internal rotation movements, such as typing, driving, or carrying objects. Over time, this creates a muscular imbalance. When a person begins to feel pain in this region, they often try to stretch or force movement without first restoring proper mobility and control. This behavior can increase joint instability. The central mistake, therefore, is not just in exercise execution, but in the lack of functional diagnosis. Before any intervention, it is necessary to identify which pain pattern is present. This can be done through simple movement tests that indicate which structure is most compromised. The location of the pain, the type of sensation, and the presence of weakness are important signs in this process. Another critical point is stimulus intensity. Many people believe that the more effort, the faster the result. In the case of the shoulder, this logic does not apply. Structures such as tendons and rotator cuff muscles respond better to progressive and controlled stimuli. Excessive load in early stages can cause inflammation and delay recovery. The correct approach involves 3 main stages. The first is reducing irritation by avoiding movements that compress or overload the affected structure. The second is restoring mobility in a controlled way, allowing the shoulder to move again without pain. The third is gradually strengthening the involved structures, respecting the current capacity of the tissue. Another associated mistake is rushing the process. The shoulder does not respond well to fast and aggressive interventions. Recovery requires consistency and gradual progression. Small improvements over days or weeks indicate that the path is correct. Lack of progress or increased pain are signs that the approach needs adjustment. Therefore, treating all shoulder pain the same way is a fundamental mistake. Each pain pattern requires a specific strategy. Correctly identifying the origin of the problem and applying the appropriate stimulus is what determines recovery. Without this understanding, even exercises considered correct can become harmful. Mistake 2. Ignoring the pain pattern and forcing movement. One of the most common mistakes among people with shoulder pain is ignoring the specific pattern of the pain and simply continuing to force movement. Many people believe that by insisting on a painful movement, they are loosening the joint or getting the body used to it. In practice, This tends to have the opposite effect. The shoulder does not respond well to force applied without criteria, especially when there is a clear pattern of mechanical irritation. The body is signaling something specific, and ignoring that signal keeps the problem active. Shoulder pain rarely appears randomly. It follows well-defined patterns. One of the most common is pain appearing within a specific range of movement, especially when raising the arm to the side. At the beginning of the movement, there is no pain. At a certain point, a pinching sensation appears, sometimes accompanied by sharp pain. As the movement continues, the pain may even decrease again. This pattern is not a coincidence. It indicates that, at that specific angle, internal shoulder structures are being compressed. This behavior is related to what professionals call a painful arc, a condition in which the internal shoulder space becomes temporarily reduced during movement. Repeatedly forcing this compression point increases irritation of the involved structures. Instead of promoting adaptation, the movement reinforces the cycle of inflammation. Pain tends to become more frequent, more intense, and over time may appear in other movement ranges. Another common pattern is weakness associated with pain. The person tries to lift the arm and notices that it does not respond as it should. There is difficulty sustaining the movement or keeping the arm elevated. In this case, the most frequent mistake is trying to compensate with more effort. The person forces the movement, uses other muscles to help, or increases load inappropriately. This behavior does not strengthen the compromised structure. It only overloads other areas, creating new points of tension. The shoulder depends on a fine balance between mobility and stability. When one structure is compromised, the body alters the movement pattern to protect the area. Forcing movement without restoring this balance creates compensations. These compensations may involve the neck, scapula, or even the spine. Over time, pain stops being localized and begins to involve larger areas. There is also a third pattern related to pain during rotational movements, such as trying to rotate the arm outward. This type of pain is usually linked to weakness in the muscles responsible for that movement. Ignoring this pattern and continuing to use the arm in activities that require internal rotation reinforces the imbalance. The result is a gradual progression of pain and functional limitation. The central mistake in this context is treating pain as an obstacle to overcome rather than a signal to interpret. The body uses pain to indicate that a specific structure is being overloaded. Forcing movement without understanding this signal prevents any recovery process. The first step should be identifying at which point in the movement the pain appears and what type of sensation is present. The correct approach involves working within a safe range. This means moving the shoulder up to the point where there is no pain or where the sensation is minimal and controllable. This limit is not fixed. It can change over days as the tissue adapts. Respecting this range allows the shoulder to gradually recover its movement capacity without causing new irritation. Another important point is movement speed. Fast movements increase the load on internal structures and reduce muscular control. Slow and controlled movements allow better body awareness and reduce the risk of exceeding the safe limit. This type of execution favors recovery because it keeps the stimulus within a tolerable level. Progression should be gradual. As the shoulder responds well to pain-free movement, the range can be expanded. This process should not be rushed. Tissue needs time to adapt to new levels of load. Rushing to recover full range of motion is one of the main factors that prolong the problem. Another relevant aspect is consistency. Working within a safe range regularly allows the body to reorganize its structures. Sporadic or excessively intense interventions do not produce the same effect. Controlled repetition is what creates real adaptation. Therefore, ignoring the pain pattern and forcing movement is a mistake that prevents shoulder recovery. Pain should not be fought with intensity, but understood with precision. Adjusting movement, respecting limits, and progressing gradually are the elements that restore function without worsening the condition. Mistake 3. Starting directly with strength exercises without preparing the shoulder. One of the most common mistakes in treating shoulder pain is starting directly with strength exercises without first preparing the joint. Many people believe that strengthening the shoulder quickly will solve the problem. However, when there is pain, weakness, or irritation, the structure is not yet ready to handle load. This behavior, although it seems logical, often worsens the condition. The shoulder is a joint that depends on dynamic stability. This means its safety is not only in the bone structure, but mainly in the coordinated action of the surrounding muscles. When there is pain, this control system is already compromised. Before any strengthening, it is necessary to restore the internal environment of the joint, reducing irritation and allowing movement to occur in a controlled way. One of the fundamental principles in this process is reducing internal compression. In many cases of shoulder pain, there is reduced space between the arm bone and the top of the joint. This space houses sensitive structures such as tendons and bursae. When a person starts strength exercises without correcting this condition, compression increases. This creates more irritation and prevents recovery. Therefore, the first step should be using movements that relieve this pressure. Passive or assisted exercises are essential at this stage. They allow the joint to move without requiring active effort from irritated muscles. A classic example is the pendulum movement, where the arm remains relaxed and the movement is generated by the body, not the shoulder muscles. This type of exercise uses gravity to create slight separation between structures, reducing internal compression. Another important point is the gradual reintroduction of movement. After reducing irritation, the next step is not maximum strength, but range control. Assisted movements, such as sliding the arm over a surface, allow the shoulder to regain mobility without overload. In this type of exercise, the weight of the arm is partially supported, reducing the effort required to move it. The mistake occurs when this phase is ignored. Many people move directly to exercises with weights, bands, or resistance. This jump interrupts the adaptation process and can cause an immediate increase in pain. Instead of strengthening, the exercise reinforces the irritation pattern. Another relevant factor is movement quality. When the shoulder is weak or painful, the body tends to compensate. This means other muscles step in to help the movement. The problem is that these compensations alter joint mechanics. Instead of working the muscle that needs strengthening, the body uses secondary structures, maintaining the imbalance. This pattern is very common in the rotator cuff, the group of muscles responsible for shoulder stability. When one of these muscles is compromised, the body tries to replace its function. The result is a seemingly complete movement, but with improper load distribution. Over time, this compensation can cause pain in other areas, such as the neck and upper back. Another associated mistake is excessive intensity. There is a tendency to believe that more effort leads to faster results. In the case of the shoulder, this does not apply. Structures like tendons respond better to progressive and controlled loads. Excessive load in early stages can cause inflammation and delay recovery. The correct approach involves stage progression. The first stage is reducing pain and compression. The second is restoring mobility with support. The third is introducing strength gradually, usually with isometric exercises. In this type of exercise, the muscle is activated without joint movement. This allows strength gains without increasing internal load. Only after this phase is the shoulder ready for dynamic resistance exercises. This process may seem slower, but it ensures safe and lasting recovery. Ignoring these steps creates a trial and error cycle, where the person starts exercises, feels pain, stops, and restarts without real progress. Another important aspect is perception of improvement. Many people expect immediate results when starting strength exercises. When this does not happen, they increase intensity in an attempt to speed up the process. This behavior is one of the main causes of worsening. Shoulder improvement occurs progressively, with small gains in mobility and reduction in pain over time. Consistency is more important than intensity. Light exercises performed daily create more effective adaptation than intense, sporadic sessions. The body responds to controlled repetition, not isolated effort. Therefore, starting directly with strength exercises is a mistake that compromises shoulder recovery. Strengthening is an important stage, but it must be introduced at the right time. Preparing the joint, restoring mobility, and controlling load are the elements that allow the process to evolve safely. Ignoring these steps turns exercise, what should be a solution, into a factor that worsens the condition. Mistake 4. Not supporting the movement and forcing the shoulder against gravity. A very common mistake during shoulder pain recovery is trying to move the arm against gravity from the start without providing proper support to the joint. This happens because many people believe movement is only effective when it involves direct effort. However, when the shoulder is irritated, inflamed, or weakened, lifting the arm on its own may be exactly what keeps the problem active. The shoulder is one of the most mobile joints in the body, but this mobility comes with a high demand for muscular control. To lift the arm, several muscles must work in coordination, keeping the arm bone centered in the joint. When there is pain, this control is reduced. This means that when trying to lift the arm against gravity, the joint may move in a disorganized way, compressing sensitive internal structures. This is the critical point. Gravity acts as a constant force pulling the arm downward. To lift the arm, the shoulder must generate enough force to overcome this resistance. When the muscles are not prepared, the effort concentrates on already irritated structures. This increases internal compression and can worsen pain. This pattern is especially problematic in situations where there is already reduced space within the joint. When lifting the arm without support, the arm bone tends to move upward toward the top of the shoulder. This further reduces the space available for tendons and bursae, increasing friction. The result is pain during movement and, in some cases, a sensation of locking. The mistake is not in moving the shoulder, but in how the movement is initiated. Before working against gravity, it is necessary to reintroduce movement in a controlled environment where joint load is reduced. This concept is essential to allow the shoulder to regain its movement capacity without creating further irritation. One of the most effective ways to do this is through assisted movements. When the arm is supported on a surface, such as a table, part of its weight is transferred to that support. This significantly reduces the load on the shoulder. In this scenario, the joint can move with less effort, allowing internal structures to adapt progressively. Another important example is movements where the arm remains relaxed and the motion is generated by the body. In this case, the shoulder muscles do not need to actively lift the arm. This creates a safer environment to begin restoring mobility. This type of strategy is often used in early rehabilitation phases precisely because it reduces internal compression. The mistake occurs when this stage is ignored. Many people jump straight to active movements, believing this will speed up recovery. In practice, this increases overload and prolongs the problem. The shoulder needs to relearn how to move before being challenged with resistance. Another important point is movement quality. Without support, the body tends to compensate. This may involve elevating the shoulder, leaning the torso, or overusing other muscles. These compensations allow movement to occur, but in an improper way. The result is incorrect load distribution, which maintains the pain pattern. When movement is performed with support, these compensations are reduced. The body can focus on correct joint movement without relying on alternative strategies. This improves motor control and prepares the shoulder for more advanced exercise stages. In addition, support allows greater control of range of motion. Unsupported movements tend to be less precise, especially when pain is present. With the arm supported, it is easier to control how far the movement goes, avoiding exceeding a safe limit. This control is essential to prevent additional irritation. Another relevant factor is the perception of safety. When movement is performed without pain or with minimal discomfort, the nervous system reduces its alert state. This facilitates recovery, as the body no longer interprets movement as a threat. Painful movements, on the other hand, reinforce the protective pattern, maintaining limitation. Progression should be gradual. As the shoulder responds well to assisted movements, support can be reduced. This process allows the muscles to regain function safely. Only after this adaptation is the shoulder ready for movements against gravity with greater load. Another associated mistake is rushing. Many people try to advance quickly to more challenging exercises. This anticipation interrupts the adaptation process and can cause setbacks. The shoulder responds better to progressive stimuli, respecting tissue recovery time. Therefore, not supporting movement and forcing the shoulder against gravity is a mistake that compromises recovery. Support does not reduce exercise effectiveness. It creates the conditions necessary for movement to occur safely. Respecting this stage allows the shoulder to regain mobility and control before facing greater loads. Mistake 5. Not controlling the scapula during shoulder movement. A frequently overlooked but extremely important mistake in shoulder pain recovery is the lack of scapular control during movements. Many people focus only on the arm without realizing that proper shoulder function depends directly on the position and movement of the scapula. When this structure does not move correctly, the entire system loses efficiency. The scapula acts as the foundation of the shoulder. It needs to be well positioned and move in a coordinated way so the arm can lift without causing internal compression. When there is pain, this control is often altered. The scapula may become elevated, rotated forward, or have limited movement. This misalignment completely changes joint mechanics. When lifting the arm without scapular control, the space within the shoulder can decrease. This increases the risk of compressing tendons and bursae, worsening pain. This is one of the main reasons many people continue to feel discomfort even while performing seemingly correct exercises. The problem is not just the exercise, but how the movement is being executed. Another important point is that the scapula works in sync with the arm. There is a specific rhythm between these two structures, known as the scapulohumeral rhythm. When this rhythm is altered, movement loses efficiency and increases stress on specific areas. Ignoring this pattern contributes to ongoing pain and functional limitation. A common mistake is trying to strengthen the shoulder without first stabilizing the scapula. Without this base, movement becomes unstable. The body compensates by using inappropriate muscles, such as those in the neck and upper back. This creates tension in those areas and does not solve the original problem. The correct approach involves first training scapular control. Simple exercises focused on positioning and conscious movement are essential at this stage. Light retraction movements, controlled depression, and stability during arm elevation help reorganize the motor pattern. These exercises do not require heavy load. The focus is on movement quality, not intensity. Another relevant aspect is body awareness. Many people cannot identify scapular position during movement. For this reason, performing exercises in front of a mirror or with guidance can help develop this control. Visual feedback facilitates learning and reduces execution errors. Progression should be gradual. As control improves, the scapula begins to follow arm movement more efficiently. This reduces internal compression and improves load distribution within the joint. Only after this control is established should more intense exercises be introduced. Ignoring the scapula is one of the main reasons for failure in shoulder recovery. Arm movement does not occur in isolation. It depends on a stable and coordinated base. Restoring this base is essential for the shoulder to function without pain.